Hi. So do you have heel pain? Do you have difficulty while walking because of the heel pain? Early morning when you step on the floor, do you have that dull aching, severe pain in your heel and you are unable to walk because of that? If it is so, hi, I'm Dr. Apurva Kadam from Teams, Joints and Motions, and today we are going to discuss about a very common issue which is called as a calcaneum spur. So what exactly is calcaneum spur? Why does it happen? And what can you do to prevent it? What kind of exercises can you do? And what is the long-term solution for this? So we are going to cover up these topics, so stay tuned with us. So calcaneum spur basically happens when there is excessive. So this calcaneum spur is basically, as you can see over here, this is a heel over here, and inside this edgy portion, this bone over here is called as a calcaneum. Okay, so in calcaneum spur there is excessive bone growth just below the calcaneum. So excessive calcium deposits होता है, and excessive calcium deposits के वजह से ये bone growth extra हो जाता है. So this excessive bone growth, when you put your weight on your foot, when you put your weight on your feet, it irritates that extra bone growth, and because of that you have that pain. So why does it happen? And when you try and do little movements and all, you feel little better. But the first step, when you keep your first step on the floor, it is very painful because you are in a resting position for a very long time. ये calcaneum bone के बाजू पीछे से there is plantar fascia which is on the lower portion of the feet, and ऊपर there is our tendon. So this fascia, the fascia on the sole of the feet gets stretched on a long time. If you are resting, that fascia is getting stretched. So when you put your feet down, again suddenly it contracts, and then it pulls on the calcaneum, and then it hurts you. So this is why. Now what are the reasons of calcaneum spur? There is no known specific cause कि इसके वजह से होता है. Generally, if you have diabetes, if you are overweight, obese, if you have long hours of standing, if you are running on uneven surfaces, you're not wearing proper shoes and running on hard surfaces, or you're doing high impact activities without wearing good amount of shoes, then this is prone to happen. So calcaneum spur is really a very common problem, and also in some conditions whenever your uric acid is high, even in that cases you have this heel pain what is there. So how do you identify whether you have calcaneum spur? So usually typically inside ये जो अंदर का portion है of your heel के inside portion of the heel, there is one typical point pain what happens. So inside there is one typical point pain which happens in calcaneum spur. Your entire feet can also ache in this condition. How do you confirm it? Confirmation के लिए there is nothing clinically these are the signs, but for confirmation you need to get an X-ray done. And what else can you do? What can you do to prevent this spur condition? So firstly, whenever you are walking, if you have long hours of standing, then that time you have to make sure that you are wearing comfortable shoes. Heels are a strict no. Secondly, if you are running or if you go for jogging, you need to make sure that you run on even surfaces. And if you are running or jogging on uneven surfaces, make sure that you are wearing good quality, good shock absorbent shoes. Okay, if you're not wearing that good shock absorbent shoes, then it is much likely that the weight will directly come on the heel and you might have heel pain. Thirdly, keep your weight in check. If your weight is too much, or whenever you're standing, your entire body weight will come on your heels. Okay, on the top of it, if you're not wearing good amount of shoes, then the pressure will not be evenly distributed, and ज़्यादा pressure heel पे आएगा, उसके वजह से आपको pain हो सकता है. Sometimes people walk in abnormal gait pattern. So ऐसा हो सकता है कि मतलब आपका walking pattern अगर right नहीं है, तो heel पे अगर flat feet है, suppose your feet is internally turned in, so उसके वजह से क्या होगा, ये वाले side के muscles, your feet muscles will go into weakness. उसके वजह से the pressure will again come on the heel, your calcaneum bone, and that is the reason you might get again sprain. Okay, spur. So what you can do for this condition, if you have flat feet, make sure you're wearing insoles. Go to a person who does customization in insoles and get proper customized insoles for you. One thing, because flat feet is a problem which keeps on increasing. If your age increases, your weight increases, then the feet keeps on going into this internally rotation में जाते रहता है, and उसके वजह से आपका पेन बढ़ने का chances है. So make sure you're wearing insoles and customized insoles पहनो. Secondly, what you can do is keep a weight or keep a check on your weight. Now do not tell me that मेरा weight बहुत ज़्यादा है तो मुझे fatigue tiring होता है तो मैं चल नहीं सकता. You try, if you have pain on 20 minutes of walking, just start with 10 minutes of walking, and slowly and gradually keep on trying increasing the distance. Okay. Thirdly, wear proper shoes. There is nothing, it is a good investment if you invest in a good pair of shoes. Fourth, what you can do is for the heel pain, whenever early morning you get up, just do gentle, before touching your feet on the ground, just do gentle ankle movement. So up and down, in and out feet movements you can do. Toe curling, थोड़ा curling of the toes कर लो, उसके बाद पैर ज़मीन पे रखो. For next thing, what you have to remember is whenever you have this pain, always wear chappals, soft sole chappals, even when you are at home, because since it is a cold season right now, a lot of cold along with hard surface will trigger and irritate the spur more. So make sure you're wearing a good quality of soft shoe chappals at home. A lot of patients ask me what kind of chappals or what kind of shoes are preferable. In chappals, if you buy a memory foam slippers at home, that will do wonders, because that your pressure is equally distributed and it is soft, so it will give you good amount of padding and the pain will also reduce. Then next thing, for the pain, one of the best things what you can do is early morning when you get up, take 2 buckets of water. One will be normal cold water, tap water, and one will be little warm water. The temperature should be comfortable for you. It should not be very hot, so it should be warm. Dip your feet in cold water and do it for both the legs. Okay, so dip both your feet in first hot water for about 3 minutes. Then immediately remove your legs and put it in cold water for 2 minutes. Okay, so this cycle has to be repeated. So 3 minutes of cold hot water, remove and keep it in 2 minutes of cold water. Again 3, 2. So 10 minutes का cycle पूरा होना चाहिए. This is called as a contrast therapy. So what we are doing here is we are trying to fire the receptors, thermal receptors, and वो pain के sensation को हम block कर रहे हैं. तो this will help to reduce the inflammation. जो भी थोड़ा irritation है, inflammation है और जो pain है वो थोड़ा spur का कम हो जाएगा. So these are the things what you can do. One last thing what you should be doing is take one water bottle, small 500 ml water bottle, put it in freezer and make मतलब ice जमा करके उसको ये करना है, use करना है. Take your feet and पैर को उसके ऊपर रखना है and just roll the water bottle throughout the sole of your foot. So पूरा आगे पीछे आपको रोल करना है वो वाटर बॉटल को. इसका पर्पस क्या है? वन, कि आइस के वजह से आपका थोड़ा जो ये जो पेन है, फीट का पेन जो है, सोल का पेन है, वो कम हो जाएगा. सेकेंडली, जब जैसे मैंने बोला यहाँ पे प्लांटा फेशिया है, व्हेन यू गिव लिटिल प्रेशर एंड यू नीड टू व्हेन यू मूव योर फीट ऑन दैट, वो प्रेशर की वजह से प्लांटा फेशिया स्ट्रेच होगा और उससे भी आपका पेन रिलीज होगा. So these are the basic tips what we know. We suggest all the patients to do with patients with calcaneum spur, but confirmative findings can also only be found on X-ray. So if you have any of these problems, just try out these home remedies, and of course there are few set of exercises which you need to do for getting rid of this pain, but and for strengthening of the muscles. So if you have any doubts, if you have any queries, we are located here in Hiranandani Estate, Thane. You can connect with us online, or you can just give us a call. Thank you.